All right. Thank you, everybody, for joining us today. This is Laura Maloof Miller. I'm in the QI Wellness Program and Department. So I am the host of the webinar today. That is new for me. I'm taking over for Kristen, who is on vacation. Just our normal housekeeping items before we begin. As you know, you are all muted upon entry to avoid any background noise. There's also at the end of the webinar going to be a short anonymous survey. So we'd appreciate you taking that as we enjoy watching or hearing your feedback. If you have any questions throughout the presentation, I'm going to do my best to monitor the chat. And again, everyone who registered, whether you could attend today or not, will receive a link to the recording after Kristen gets back in the office. So just a few days from now. Next slide, Alma. All right, today's topic, alternative health for pain management. I am delighted to have my colleague, Alma Pham, on the line today. She is going to be presenting on our topic. Next slide, Alma. Just keep in mind the information that she goes over today in this presentation is intended solely for the general information of the audience. This is a clinical topic. However, it is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So please welcome Alma Pham.
Good afternoon, everyone. Thanks for tuning in. I'm happy to be here to present on this important topic. During this presentation, I'll do an overview of pain, and we'll go over conventional methods to manage pain. And then we'll explore alternative methods. And then along the way, I'll give you resources, and we'll have an opportunity to practice one of these methods. So just going to go ahead and dive in. So pain is something many of us have experienced or are experiencing, or even know someone that is. 1 in 4 US adults are affected by chronic pain. And pain is a distressing feeling that could range from being annoying to debilitating. And it can interfere with a person's quality of life and their general day-to-day functioning. But sometimes pain does have a purpose. It can alert us that we've sprained an ankle, for example. But for many people, pain can be lingering for weeks or even months after the fact. Pain doesn't only impair us physically, it can affect us mentally by impairing our concentration, our focus, which can then affect our ability to problem solve and process information. But pain can also affect us emotionally. It can leave us irritable, depressed, and anxious. So there are 2 categories of pain. There's acute pain. Acute pain is sudden and typically lasts for a short period of time, say 3 to 6 months, and it typically resolves once the underlying cause is treated. And then there's a subcategory called subacute pain or unresolved acute pain, and this is pain that lasts 1 to 3 months and can evolve into chronic pain, which is the second category. So chronic pain persists for longer than 3 months, and often it can go beyond the expected healing time. And there's a subcategory called high impact chronic pain. And this is a type of chronic pain that accompanies at least one major restriction. So for example, you're unable to work outside the home, go to school, or do like day-to-day daily activities. So high impact pain is the most common reason adults seek medical care and is associated with decreased quality of life, opioid misuse, increased anxiety and depression, and mental health needs that tend to go unmet. So the causes of pain varies, and it can include sports injuries, so like your fractures, your sprains, strains, or torn ligaments. It can be caused from accidents and trauma, such as a car accident or a bike accident. Pain can come from post-surgery, aging, and falls, and even chronic diseases. So the treatment of the pain can change from the cause of the pain. So for example, the treatment of a sprained ankle from a sports injury would be treated differently than pain caused from torn meniscus or even a motor vehicle accident. So conventional treatment for pain is with medication or treatments. So medications can include opioid medication, non-opioid medication, antidepressants and anti-seizure medication, steroid injections, and pain medication can be in various forms. So it can be oral, injectable, infusion, subcutaneous infusion, ointments and creams, or a block. And then for treatments, these tend to be non-medicated. So this can include the use of electric nerve stimulation. So you might have heard of like an Easton machine. This is where as a sensation, like a very mild electric current provides a sensation to the nerve that blocks the signal of pain to the brain. There's also therapy, such as physical therapy, occupational therapy, massage therapy, and even hydrotherapy, which is therapy in the water, and surgery. So when we use the term complementary medicine, this refers to a range of medical treatments that fall beyond the scope of conventional medicine, and it's often used alongside of the conventional treatments. So the goal of complementary medicine is often to improve the overall well-being of a person, manage their symptoms, and enhance the quality of life. It's important to, of course, consult with a healthcare professional before starting any complementary treatment to ensure that it's safe and appropriate for your specific health needs. So there are three complementary medicine practices that I want to mention today. It's acupuncture or acupressure. This ancient practice involves inserting a thin needle or applying pressure into specific points on the body, known as meridians and acupoints. It can stimulate nerves, muscles, and connective tissue, potentially reducing pain and promoting healing. The next one is chiropractic care. So this is the use of manual manipulation of the spine and other techniques to improve your alignment and relieve pain. So this would be particularly for conditions like back pain and headaches, where the adjustment is focused on the cervical or the neck area. Then there's also herbal medicine. So certain herbs such as turmeric and ginger have anti-inflammatory properties that can help reduce pain, especially if it's increased by inflammation. So additional pain management techniques include mindfulness and meditation, yoga and Tai Chi, guided imagery and relaxation techniques, music therapy, and distraction techniques. So we'll be diving into these techniques more closely. There are several types of mindfulness and meditation practices to help with stress, anxiety, sleep, and etc. I'll focus on only the types that will help address pain. So mindfulness is a state that involves focusing on awareness of the present moment and taking it in without judgment. Where meditation is a practice that involves mindfulness techniques, and it includes focusing one's attention to a thought or a sound or even breathing. So I have 4 examples of meditation. The first one is mindfulness meditation. This practice involves paying attention to your thoughts or your feelings and even your sensations in the present moment without any judgment. And it helps increase awareness and reduce stress. The second one is body scan meditation. So this technique involves focusing on different parts of the body, usually starting from your toes and then moving up to your head. So this is to notice any sensations or tension in your body. The third one is breath awareness meditation. This simple form of meditation focuses, of course, on the breath and observing its natural flow and rhythm. The fourth one is guided meditation. So in this practice, a guide or a recording leads you through a meditation, often focusing on relaxation, visualization, or specific themes like healing or stress reduction. And so later in this presentation, I'll guide you through this practice. I've also included a resource here in the box. You'll see there's a TED Talk through YouTube called A Different Approach to Pain Management, Mindfulness Meditation by Fidel Zidin. Feel free to check this out if you'd like to know more about mindfulness meditation for pain management. Right, so the first alternative method would be yoga and Tai Chi. These are both ancient practices that promote physical, mental, and emotional well-being, but they have different origins and methods. So yoga involves a combination of physical postures that are referred to as asanas, and it can also include deep breathing called pranayama. Tai Chi involves the slow flowing movements combined with deep breathing and focus. So both yoga and Tai Chi can improve flexibility, strength, and balance, and relaxation as well. And you can check if these classes are offered for free or a small fee within your community. Some of you may have seen, like in parks, there's a group that is practicing yoga or Tai Chi. So those are usually more like community events. And some health plans may even offer a discount to boutique fitness studios that offer yoga classes or Tai Chi classes.
Oh, Alma, I'm sorry to interrupt you.
No
Do you
problem.
have the ability to click on transcript at the bottom of the screen?
Let's see.
Enable transcription.
Do you know what the icon looks like? Is it
It has like a piece of paper.
okay?
because
Is it okay, I see
I
something.
think it's working now. Thank
Okay,
you so much. Please
yeah.
continue.
Thank you. Okay, so getting into distraction techniques. This can be very effective in managing pain by shifting your focus away from the discomfort. So some common methods include counting, and you may have done this like if you've ever gone under anesthesia. So you would count forward or backwards, or even in multiples in twos or threes, etc., to engage your mind. So your mind should be all focused on counting and distract you from pain. You can also read or do audiobooks. So diving into a good book or listening to an audiobook to distract your mind. Crafting, knitting and crocheting is kind of the new rage right now. So engaging in arts and crafts, which can be therapeutic and provide a sense of accomplishment. Watching TV or movies So enjoying your favorite show or movies to take your mind off of the pain, playing games or puzzles. So video games, puzzles, or board games can be a great distraction. And enjoying a good scenery. So just spending time outdoors. There's been a lot of studies showing that the outdoors has mental, emotional, and physical benefits. And then if you're active and of course your doctor has cleared you for physical activity, consider substituting or modifying your exercise by working with your physical therapist, appropriate fitness specialist, or knowledgeable coach that is well-versed in modified exercises for injuries, to help you get started in that direction. So breathing techniques. Breathing techniques can be very effective in managing pain by helping to reduce the stress and promote relaxation. So as I mentioned earlier, pain can bring about these feelings. And here are a few techniques that you might find helpful. So these are 3 different methods of breathing techniques. This is always my challenging word here. Diaphragmatic breathing. So belly breathing. Place one hand on your chest and the other hand on your belly. We're going to give this one a little tryout. So when you take a deep breath through your nose, your belly should fill with air and push your hand out. But your chest should still remain relatively still. So I'm going to give you a moment to give that a try. So one hand on your chest, one hand on your belly. You're going to take a deep breath through your nose, and you should feel the belly push up. So that is what diaphragmatic breathing or belly breathing is. There's also 4-7-8 breathing. You inhale through your nose for 4 counts, hold your breath for 7 counts, then exhale completely through your mouth for 8 counts. And then you repeat that 3 to 4 times. Mindful breathing focuses on your breath with each inhale and exhale. And then you would pay attention to the sensation of the air entering and leaving your nose. So these techniques can help activate your parasympathetic nervous system, which promotes relaxation and can make pain more manageable. Okay, so guided imagery is a relaxation technique that involves visualizing positive, peaceful images. It often involves a guide or recording that leads you through a series of common scenarios. And this practice can be used for various purposes. There are some that exist for like sleep, for anxiety. But for this presentation, we're going to use it for pain. So many of you may already be doing this practice and not even know it. So for example, to reduce anxiety on a presentation, you may visualize yourself speaking in front of a group and feeling at ease. And to improve performance in sports, you may visualize yourself sticking a landing or hitting a home run or scoring a goal. So guided imagery can also help manage pain by leveraging the mind-body connection to create a state of relaxation, which then can alleviate the perception of pain. So how does it work? The first part is distraction. So by focusing on positive, calming images, guided imagery can divert attention away from pain, making it feel less intense. Then the second component is relaxation. So it promotes a state of deep relaxation, which can reduce muscle tension and stress hormones that often worsen pain. And the third component is positive visualization. So imagining a pain-free scenario can help reframe the experience of pain, making it more manageable. So this is the exercise that I wanted to share with you today. We're going to do a guided imagery and relaxation exercise. So I'll give you a moment to settle into your seat. And as you settle into a comfortable position, notice how you are feeling in this moment without trying to change anything. Just observe your body and mind. Go ahead and close your eyes or soften your gaze downwards and scan your body. So earlier I talked about like a breathing scan. So ask yourself, where is most of your tension stored? And then ask yourself, where is your pain located? Next, ask yourself, what part of your body is most relaxed? Now take a deep breath in and exhale. Go ahead and continue to breathe in and out slowly and smoothly. Now notice how your whole body feels. Passively observe, not trying to change anything, just simply take note of how your body feels. Now take a moment to think about the pain you experience. You may not be in pain right now, but just observe the state of your pain in this moment. The way your body feels is always changing. A moment from now, you will feel slightly different from the way that you're feeling now. So just observe as each moment passes. Although pain is unwanted and difficult to tolerate, try for the next few moments to regard your pain with acceptance. Accept the way you are feeling right now, physically and emotionally, whether it's positive or negative. Allow your body and mind to just be. And after you observe thoughts and feelings, this is a great spot for an affirmation. So taking a deep breath and say, I accept myself. As you exhale, let go of the need to control or change this moment. So let's repeat that affirmation. Taking a deep breath and say, I accept myself. And as you exhale, let go of the need to control or change in this moment. Now that you have repeated some affirmations, just relax for a few moments and let go. So just be. There's nothing you need to be doing in this moment besides accepting this moment just as it is. Next, observe again your pain and notice that you can alter the pain slightly. See if you're able to transform this feeling just a little. Picture the pain, notice its exact location, and imagine that instead of pain, this area feels cool, even a bit cold, as if you have applied a comfortable ice pack to this area. Feel the coolness. The area might even start to feel, let's see. The area might start to feel just a little bit more cold. You may start to wish, or you may start to feel the sensation of pleasant tingling or warmth, soft but firm, or even comfortable pressure. Imagine this sensation. Imagine the sensation replacing just a tiny bit of the pain. and a tiny bit more.
Elma,
Yes.
can you hit the transcript again? It for some reason stopped.
Oh, I just gotta, I will, my computer's gonna be, oops, I deferred it.
Oops.
Oh, can you see it?
We're back at notes and presentation. So you're gonna go back to from current slideshow from current slide.
Do you see it?
I see. Yes, I think, yes, we're good. Thank you.
All right. Sorry, folks, for the technical difficulty. All right, so let's go back to imagining the sensation. You're replacing just a tiny bit of the sensation with your pain. And then you feel this new sensation growing pleasantly, providing some relief and allowing you to relax. Take a deep breath in and let it out. Take another deep breath in and let it out. Again, breath in and out. So take note of how your body feels now and see how relaxed your muscles are. Notice how calm your mind is. And enjoy this feeling of relaxation for a few moments more. You can keep this feeling of relaxation with you as you return to your regular activities. Memorize this peaceful, relaxed feeling so you can return to this state whenever you need to. Okay, so slowly reawaken your body. Take a deep breath in and out. Feel your mind and body becoming more awake and alert. Move your arms and your legs and stretch your muscles to let them reawaken from this pain management relaxation. Sit for a moment now with your eyes open, observing the room around you. And when you are ready, return to your usual activities, keeping with you a sense of calm and relief. So this is a sample script that I found online. You can definitely develop your own or even find a recorded guide to lead you through your personal guided imagery exercise. And if you enjoy guided imagery for pain management, again, feel free to explore other guided imagery for other purposes like stress, anxiety, sleep, and other things. Next, I want to talk about music therapy. So this is another method that is growing in popularity. I'm hearing more hospitals are staffing their very own music therapist. Music therapy is an effective approach to managing pain by using music to address both the physical and emotional aspects of pain. So here are some ways it can help. It can help with distraction. Music can divert attention away from pain, reducing its perceived intensity. It can also help with relaxation. So listening to calming music can lower stress and anxiety levels, which often exacerbate pain. Music therapy also has a mood enhancer. So music can elevate mood and reduce feelings of depression and isolation, which are common in chronic pain sufferers. It also has physiological effects. So music can lead to physiological changes, such as lower blood pressure and reduced levels of stress hormones. And lastly, you get like an active engagement. So activities like singing, playing of instruments or songwriting It can provide a sense of control and empowerment, enhancing pain management. So I wanted to share this video with you.
When you think about it, a person comes into the hospital and they lose so much of themselves. Music helps as a bridge to bring out those internalized aspects of who they are, and that in turn helps them heal, and it helps them find the hope to heal, and it keeps them positive throughout their experience. Speaking words of wisdom, let it be. So specifically at university hospitals, we actually assess patients on an acronym that we call SPACE, which is stress, pain, anxiety, coping, and then we also provide education. All of these elements seem to have an impact on each other. We actually have empirical evidence that shows how music can help reduce a person's pain perception. We've completed several studies here at university hospitals that show that on average, a patient in pain can reduce their pain perception of about 20%. And that's non-pharmacologically, that's just with music. Music therapy and these services are meant to be hand in hand with traditional medicine. So we're not here to replace, but we're here to make the person's experience better and also restore that human element to their treatment. When the night is cloudy, there is still a light that shines on me. Shine on till tomorrow, let it be.
Love that. Okay, so next I wanted to talk about medicine. I did mention that earlier as a conventional approach, but I wanted to dive a little bit deeper into medicine because again, everything that I've mentioned in this presentation is complementary or alternative to work alongside your conventional treatment. So this right here is a list of medicines that can be used to manage pain. And so there's two different categories. There's opioids. Opioids can be used when benefits for pain and function are expected to outweigh the risks of opioid. And this can include Vicodin, Percocet, Percodan, and others. And then there's non-opioids. So these are therapies that are preferred for subacute and chronic pain and are at least as effective as opioids for many common types of acute pain. So we know this as Tylenol, ibuprofen, Motrin, Aleve, Excedrin, Voltaren, which is a topical application, and others. So why non-opioids are preferred is safety. Opioids carry significant risks, including overdose, addiction, and death. For its effectiveness, non-opioid options can be effective for many types of pain and may be more effective for certain conditions. Also for reduced risks. So non-opioid therapies often have fewer side effects and lower risks of dependence. So as I mentioned earlier, medication can be effective in managing pain, especially chronic pain. But please keep in mind, before starting any over-the-counter or OTC medications, always consult with your physician or pharmacist first to make sure you understand the importance of taking the medicine as prescribed, including how it works and its potential side effects. And 3, there are dangers with opioid medication. And because of the fentanyl crisis and person being on higher dose opioids, we now recommend naloxone, and I hope I'm pronouncing that correctly. If you are on an opioid, talk to your physician about naloxone. Depending on your opioid medication dosage, you may need naloxone in case you take too much of your prescribed opioid. So what is naloxone? So naloxone is a life-saving medication that can reverse an overdose from opioids. And this includes heroin, fentanyl, and prescription opioid medications when it's given on time. Naloxone is easy to use and small to carry. There are 2 forms of naloxone that anyone can use without medical training or authorization. It comes as a pre-filled nasal spray and injectable. You don't need a prescription to purchase naloxone, so you can check with your local pharmacy, convenience store, grocery store, and yes, even gas stations. So to find where you can buy naloxone over the counter. I hope you learned about alternative ways to manage pain that you can practice for yourself or share with someone you know that is managing pain. I'm going to hand it back to Laura to go over some programs and resources before wrapping up this presentation.
Thanks so much, Alma. That was super informative. I unfortunately had having to use naloxone with my sister. She was recovering from a knee replacement. And so she received a combination of medications, including opioids. And when she came home from the hospital, I thought she was just sleeping, but I couldn't wake her. So I did have naloxone with me, and I sprayed it into her nose, and I was able to get her to wake up. So thank you for mentioning that, Alma, because that's really can be a life-saving drug for everyone. So next slide. I'm just going to go over at the end of our webinars, we always cover programs for our HealthNet members. So you guys can find all of our wellness programs and other resources when you log on to your HealthNet account. Next slide, please. All right, our health risk assessment. This is called the Real Age Test, and it's a great place to start if you'd like to know what your health status is in different areas of health, such as nutrition, exercise, emotional health, even financial well-being. It may actually give you results that will have some additional recommendations for programs that you may be interested in. Next slide, please. And we offer health coaching. Sometimes it's really hard to change a health habit on your own. So don't do it alone. Get help with a health coach, especially if you're trying to make some lifestyle improvements. Alma talked about, managing stress and other areas that you may want to work with a health coach to help keep you motivated. Next slide, please. Craving to quit. We do know that the rates of smoking, vaping, and stuff have gone down in California, but we still offer this program. It's our tobacco cessation program, and it's really designed for those that are ready to quit, to permanently break their addiction to different types of tobacco. Next slide is Eat Right Now. So this is our mindful eating program. It helps. It's not a diet. It's about healthy eating habits. So it's going to cover things like triggers, cravings, healthy habits, and also emotional eating. Unwinding. We know that life is stressful. So this program has useful tools. It has videos and modules. It's a self-help program really focused in on decreasing chronic stress as well as building resilience. And we offer discounts for our members, so please take advantage of these. Things like Weight Watchers, we have chiropractic and acupuncture service discounts, as well as hearing aids and even our pretty popular fitness club discount. So you can change clubs as often as you like for a small fee, $28 a month, gives you access to over 14,000 gyms and online demand programs. And we have online challenges going on every month. So these are open to everybody. So every month you'll see online challenges regarding stress, steps, sleeps, and nutrition. Specifically for HealthNet members, we are in the middle of a 90-day Healthier You challenge. So make sure to check that out. And next month, so join us. We're already in May, everybody. Next month, join us for mindfulness in the workplace. So this is going to be an interactive and experiential session. We're going to be looking at the power of mindful presence in our relationships, in our projects, in the work environment. We'll have the opportunity to discuss and explore and practice several approaches related to mindfulness, self-care, enhanced attention, and collaborative wellness. So we hope you join us for that next week. And don't forget, everyone is going to get a recording of this webinar along with the slides in just a couple of days. So we appreciate your attention today, and feel free to exit the webinar at this time.
Thanks, everyone. I'm sorry for the technical difficulties. Have a great day.
Thank you so much, Katie. We appreciate your time.